I became a gynecologist in Italy, where I my study. And from that day, I decided to come back to Somalia, but it was not very easy to come back in that time. Everybody knows Mogadishu was fine. I'm from Mogadishu. I was born and grew in Mogadishu. I was facing one of the biggest challenge in my life when I was facing a patient with a fistula, which caused by a female genital mutilation. Female genital mutilation is called FGM, and it's a cultural practice. I cannot say religious, absolutely. And fistula is an abnormal communication between organs, such as bladder to the vagina, rectum to the vagina, or bladder to the uterus. Zainab is one of the patients come to me, one of the young girls returned to me as a patient. She was 21 years old. She was married, just married, and she had her first pregnancy. But unfortunately, when she was delivering, she got a problem. She failed to give birth. Vulva is supposed to be enlarged. The vagina needs to become soft and open the place. But who has FGM, there is not valve and there is not space to enlarge. So many, they got that problem. Unfortunately, Zainab was one of that person. After many days with a labor pain and delivery, she delivered, but the baby died and she developed fistula. You can see that area where she developed the fistula. Not only that, her husband left her because one of the complications after fistula is they leaked urine all the time. They have many characters common, these ladies. They are under 25 years old, first pregnancy, the baby died, they developed fistula, and even the husband left. Zainab met me, and I operate her problem. We just closed the hole. Fistula means a hole between two organs. And it's the baby who makes that hole, staying many, many, many hours, days, weeks, which cannot happen anywhere in the world. To have a labor pain, weeks, days. I can even teach you, do it, that operation. It's very easy, but the problem is, it's taking a time to prepare, it's taking a time to recover because of lack of equipment, lack of places, lack of possibility to do. Fortunately, Zainab, she recovered the problem. I operate 78 patients like Zainab. It was 2010. We had some, we didn't succeed because they have a big hole. The hole is become ischemic, means you cannot repair. There is not any tissue you can repair. So you need plastic surgeon to consult, where it is not available in Mogadishu. That's why a lack of many specialists even, you cannot do whatever you want to help people. During that time, I was asking myself two questions. Why does a woman have to suffer under the hands of another woman? Means is the woman who did this horrible operation. The second question, can training women be the solution to this problem? Then I start to write a manual, not book, but manual in Somali language to explain, to train a woman, a midwives. Not midwife qualified, but traditional midwives. We call TBA, means traditional birth attendants. They are the one who practice the infibulation, and they are the one who assist. It's really very funny because she's the one who did these mistakes, and she's the one who is facing and assisting and seeing the difficulties. And finally, she's the one who, so for me it was very, very, I was not understanding. I met a lot to find out where is the problem. My book, my manual is in Somali language, and I called Illustrated Obstetric. Obstetric means a woman issue, woman in pregnancy issue. And I used illustrated because it's a lot of pictures. I didn't use words. The 78 patients I operated, more than 50% they didn't know how to write their names. After finishing writing the book, a manual, we collected from the districts, the ladies. We selected to correct districts far from Mogadishu. I rejected to train people in Mogadishu and neighbors because that's 78 patients I operate. They mostly come from rural zones. We collect far from Mogadishu, like Bakol, Gedo, Bardere. Mostly they were in the border between Somalia and Kenya, and also Ethiopia and Kenya, up to Beledweyne. We gave them 4 weeks theory and 8 weeks practice. They didn't know how to use delivery beds. Also, delivery beds, we have different kinds. The standard one, even, they didn't know. And can you imagine, in 2012, some of these traditional midwives, they were assisting delivery without gloves. Forget about other instruments, sterile or clean or whatever. We teach them how to use these equipment and explain them what is this equipment, and not sterilized, but at least to clean. We gave each midwife 2 kits for delivery and 1 delivery bed. The delivery bed, I have 1 original in Martino Hospital, and they are 12. So what we did, they did a copy. Our professional mechanic people we have in Mogadishu, they really did a copy from this, and they use materials we have in Mogadishu, like metals, and both small materials, very thin, and it comes good. Martin Hospital looks like that when I became a director. Was just by name a hospital. It was empty, destroyed, left 22 years ago, and completely non-function. I started to renovate the hospital, and at the same time I was training. We started training them first group June last year. Now it looks like this. This is exactly maternity ward. This is the place we prepare in Martin Hospital. We prepare second phase, second training group. They are coming from 12 districts, far from Mogadishu. This time I think we are going from central to north. They will be welcome. We train them here, same 4 weeks theory and 8 weeks practice. It's good. Alhamdulillah, Somali people, they are very bright people. Just they need someone who can teach them, and they are very, very excellent. After finishing the training, we made a deal. First, they have to send, if the mom, she cannot give birth within 48 hours, they have to send to Mogadishu. The problem is there is not possibility to come. We cannot give them a transport, and we cannot sponsor even that. The second deal is don't do more the infibulation, the female genital mutilation, because we explained them what was causing that fistula. And Zainab, as well as other patients with her, like Timiro and Malava, they are now participating in the program, and they are happy. So thank you very much.